Hello and welcome to Pulse, your podcast delving into all things health, innovation, digital and data. Proudly brought to you by Pulse IT News. I'm your host, Louise Shaper.
And I'm your co-host, George Marcellus.
George, you're all packed. You're getting on an airplane tomorrow, I believe.
I am. I haven't started packing yet, but of course, having done this a few times now. Although I must admit, I checked the weather and I saw overnight temperatures nearing zero. So I probably have to go and dig into my woolies. But you're looking forward to off to a couple of days in Greece before we head off to Barcelona for the Digital Health and Wellness Summit there at part of the Mobile World Congress, which should be a lot of fun.
Oh, that'll be so good. And actually, Ryan and I were talking about needing to book a holiday later this year. And we had Greece booked before COVID. And we never got there, obviously. And I said, we should talk to George and coordinate. Even Ryan jumped in and finished my sentence. He's like, can we go at the same time George is there? I said, well, yeah, I just thought just for 1 or 2 nights and meet the Marcellus clan over in Greece.
I can even introduce you to the Digital Health Society that's based in Athens as well. So, yeah.
All right. We'll have to coordinate that. Oh, we could do a podcast from when we're in Greece together, maybe.
Absolutely. With pictures of Hippocrates.
It's where it all began, Yeah. And what are you looking forward to with your trip?
Look, we're spending some time catching up with some relatives and people in Athens, but the Digital Health and Wellness Summit, it's a pretty big, Mobile World Congress itself is just a zoo of a show. It's huge. It covers all the mobile technology. But they have a dedicated startup group called 4YFN, which stands for 4 years from now. And within that, they have a health and tech summit. So interestingly, shock horror, one of the big topics is AI. It should be interesting catching up with some old friends, the colleagues from the ECH Alliance, Brian and Andy and the team there. They've got an interesting mix of people coming around from around the world and see how it all plays out.
Yeah, Brian and Andy are so well connected.
Elaine was there as well, so hopefully Elaine will be there. Rick will be there this year as well, and hopefully catch up with him. What have you been up to the last couple of weeks?
Just pretty boring. I'm just trying to anything interesting. I do have a health-related story. So my dad, with his conditions, had to see a heart specialist, and he hasn't seen the heart specialist for over a year. Anyway, so they're at the heart specialist. My mum called me afterwards, and she was so upset. I was really pissed off. Mum was more polite than me. They're sitting in the appointment, and the doctor's talking about heart stuff with Dad. Anyway, and Mum's like, well, what about the cancer? And the doctor goes, what cancer? Yeah. So a referral letter had gone to this clinician, and the guy was not told that my dad has the big C, and it's a very aggressive and, he's lucky to be here sort of diagnosis, not being treated, but he is on a whole bunch of medication for that and other things. And he didn't even have a complete list of my dad's medication. And when my mum raised it, my dad turned around and was like, he doesn't need to know that. Like dad's in that generation, like, oh, don't bother the poor doctor. And so the doctor's like, what? I do need to know. Luckily, Mum keeps a piece of paper with her at all times with a list of things that my dad's diagnosed with and his pills. And as a result, the clinician took Dad off one of the pills and said that was probably causing, he's had a pretty worsening in one of the symptoms. So he's taken Dad off those pills, and so far so good since he's been off them. But I just couldn't believe it. And I'm like, Mum, this is why I do what I do. There's a whole community making sure that hopefully information gets adequately passed around the healthcare system.
Just imagine if there'd been a national health record where someone could have logged into and found your father's medications and passed pathology. How interesting, how different that would have been, eh?
Yep. Yeah. And luckily my mum mentioned it because my dad was not going to. And if Mum wasn't there.
And I was actually in a discussion earlier this week with a company that's out of Vietnam who's been talking about integrated care, sort of saying, how important it is to have a single source of truth about things like diagnosis, and the expectation that people will have them all in the back of their minds ready to rattle off at a consult, it doesn't really exist. And the technology is no longer the challenge. We know we can do this. Personal health records go back 25 years. And yet it's even more striking when it's someone like yourself in your family who's been working on it for 25 years and you see it falling apart around you.
I know. All of our work, George, has come to naught. What are we doing with our lives?
I think Matthew Holt touched on that, didn't he? We'll be talking about that later, but yeah, it's a bit scary.
He does. We will be coming to that. Yeah. Well, it's probably a good segue to our first hot topic. Firstly, George, we can't go past the big news that Australia's share by default legislation was passed by the Australian Parliament last Wednesday night. Yay. This is a big deal because it means that all Australians will have access well, at least theoretically, maybe not my dad's case, to their health information, beginning with pathology and diagnostic imaging reports via My Health Record. The legislation is called the Health Legislation Amendment, Modernising My Health Record, Sharing by Default, Bill 2024, and it's now law. The bill received royal assent last Friday, so it's now the Share by Default Act 2025. This doesn't mean the provisions of the Act are activated, as rules need to be drafted for this to occur. It's important to note that there is still work the Department of Health and Aged Care and healthcare providers need to do to roll this out across the health sector over the coming months. But there's already 4 states, notably Queensland, South Australia, ACT, and now Northern Territory. Not your state or mine, George, yet. But anyway, there are states that have already signed up to this, plus there's a significant number of large pathology and diagnostic imaging providers who are already sharing by default. Now, we do have an election coming up sometime soon in Australia and a budget, so the government will be a tad busy. But in the meantime, I expect a lot more providers are going to jump on this train. What did you think when you heard the news, George?
Look, it was exciting. And I must admit, I was at the speech last year at Victorian Healthcare Week where the minister announced they're putting this legislation through. It's legislation we've all been waiting for a long time. It's a little disconcerting that we had to use the stick. We couldn't use the carrot to get it over the line, and the concept that sharing by default should be a natural thing. But it's a big deal because it strips away that old paternalistic idea that health consumers don't want their own health information because it's too scary for them and their little minds just can't comprehend it. So it has to be something which is stored away in secret filing cabinets. I do remember a few years ago, I was told by a radiology practice I went to get an x-ray not to open the envelope of films and report that they gave me because I have to scurry off and take it to the doctor because they will be able to explain to me how complicated this x-ray was, which basically showed that I didn't have a fracture. So, I mean, it could have been basically sort of said, it's okay, but no, yeah. They had this sealed envelope with a thick piece of sticky tape on the back of it. And the thing I do not open, for doctors viewing only. The bizarre thing, of course, is that I had written my own request form for that x-ray. So the doctor that I was taking it to was me. So it was like, okay, I can sit here and be really smart about this and have a interesting discussion with these people. But I just sort of nodded and sort of said, yes, I'll do exactly as you say. I'll take it to the well-trained doctor who'll tell me exactly that nothing's wrong with me. But it is seriously something this is not secret doctor's business. This is something that needs to be shared. And we touched on it very early on in one of our discussions with Liz about open notes. Yeah. The idea that the patient's records form a critical part of their own knowledge base is interesting. I clicked on the Open Notes website today. There must be some interesting points there. They have a really nice history page. I don't know if you've ever been to it. The concept goes back to a 1973 paper in the New England Journal of Medicine titled, and you'll love this one, Louise, because it does show how male-oriented we were back in 1973. The title of the paper is Giving the Patient His Medical Record, a proposal to improve the system by David Warner and Bud Schenker, so.
We'll let that pass. It was the 70s.
Yeah, it was the 70s. I mean, I thought they would have been a bit more nuanced there. But it's interesting. Like back in the 70s, Australia was forward thinking. We had brought out Medibank, the first national health insurance models. We were doing things differently, but 50 years later, we're just starting to see some of these ideas come to fruition here.
Yeah, it's really exciting. And it's cool you mentioned Open Notes because I noticed Open Notes did a post on LinkedIn congratulating Australia for this move to share by default. So thanks, Open Notes, for the shout out.
Much appreciated. Now, if only we can get the other 99% of the documentation also shared, we probably get to where we want to be.
Yes. Well, there's a lot of very busy people, friends of ours and friends of the pod working on that. So the work will continue in earnest. Now to our next hot topic. We talked a lot about New Zealand in 2024, with the year ending not so great for those guys. It ended with $330 million being cut from the budget, 47% of the Health New Zealand Te Whatu Data and Digital Directorate staff being told they're going to lose their jobs, and key roles being made disestablished. Well, in an interesting turn of events, the Public Service Association of New Zealand, which has around 25,000 Health New Zealand staff, have filed a lawsuit to try and stop the cutting of thousands of roles across the health sector. The suit includes cuts to roles outside of the Data and Digital Directorate, including the National Public Health Service and the Pacific Health Directorate, claiming that the safety and health of workers and patients, of which the government has an obligation, of course, was not taken into account. Friend of the pod, Will Jensen from Digital Health Association in New Zealand has echoed the concerns, saying that there's over 6,000 IT applications across New Zealand's health system, many of them older legacy systems. And separately, the Public Service Association is also urging the Privacy Commissioner to urgently investigate Health New Zealand's plan to gut the Data and Digital Directorate on the grounds that it would threaten the security of patient data. And George, I noted a video which was shared with staff and, of course, shared online about the cuts, which advocated for, and I quote, it advocated for a fail early, fail often, succeed over time strategy. And they said they couldn't afford to have anything other than, and I quote, one vanilla flavoured brown bag, common cheap solution per problem. Yeah.
It is scary. We know that gutting your healthcare system, laying off staff, getting rid of people who support critical solutions has consequences.
Yeah, big ones.
And the consequences can be very significant. So this is just an example of not having that forward thinking about what the consequences are. It's even more frustrating. The money is now being spent on lawyers and privacy and security being put at risk, and the health of our Kiwi colleagues is being threatened purely by a lack of planning around resources and recognising the value of the resources. We tend to get a bit of that to and fro, because one government does it, when a new government comes in, they have to do the opposite. And it's concerning because as Australia is getting ready for an election, just by having a change of government leads to an entire change of mindsets, which have consequences. We all pay the price for all that down the track.
Yeah, it'll be a story we'll come back to and see how that resolves, because a final decision hasn't been made. But, when the government says you've got to find billions of dollars of savings and that slash and burn approach without necessarily thinking about the security of patient data and the systems.
Unfortunately, we've seen this cycle before, where they slash staff, then realise that they're under-resourced, then bring in consultants to fill in the staff, then bring the staff back and go through that vicious cycle. But just also what it does for the morale of those people involved in delivering the service. Being let go, knowing you're doing your job well and doing it to the best of your capability and showing benefits, and then having to reapply for your old job again 12 months later when they realise, someone did know how to turn on that system. It is important that we understand how it works. It is frustrating, and hopefully New Zealand won't suffer too many consequences from it. But if history is any guide, I suspect in a year or two's time, we'll be talking about the scurry by New Zealand to find well-trained people to fill roles that are critical.
Yeah, because they would have all left. All right, well, we'll keep an eye on that. Now, let's move over to startups and investors. A new report has come out called The State of Australian Startup Funding 2024, authored by Cut-Through Venture. The report does mistakenly group medtech and biotech together, but that aside, the report states that $4 billion, and obviously this is Australian money, $4 billion was announced in funding last year, with the top categories being fintech, climate tech, and then biotech and medtech. And biotech and medtech combined had $347 million of deals. Overall, the sentiment was positive, but we note that many companies had to accept a down round for their latest investment. And for those pulse potties that aren't familiar with that VC investment term, basically a down round is when the startup raises money at a lower valuation than its previous funding round, meaning that the company is considered worth less than it was in the past. But then we move over to the US, and Rock Health has released their 2024 year-end report showing that digital health startups were funded to the tune of $10.1 billion last year. Although that's actually a huge figure, of course, but it takes it back to about 2019 figures. Their commentary noted a David and Goliath dynamic in the healthcare innovation landscape in the US, with early-stage startup activity amidst heavyweight investors and big tech players. Also in startup news, Australian health AI company Harrison AI made the news everywhere when they raised $179 million Australian in Series C funding to further scale their international reach. Now, they haven't commented publicly on their valuation, and fair enough too, but AI tools tell me they guess that it's probably about $240 million. That may be incorrect, but I'll blame AI for that, giving me that answer. Congratulations to Harrison AI for the round. But in comparison to the US, these numbers are small. US health insurance startup Devoted Health is worth $12.9 billion. Hims and Hers online telehealth and prescription services has a valuation of $13 billion. And Doximity, known as the LinkedIn for doctors, has $14.5 billion market cap. And friend of the pod, Matthew Holt, penned a great post on LinkedIn. And I was trying to think of how I describe this. And I thought, you know what, it's probably just best I read out his post. So this is Matthew Holt's post. He said, "So it's 2010. We're all excited for digital health to revolutionize healthcare. The time traveler from 2025 comes back and tells you, basically, nothing much has changed. The incumbents are the same and they use the same shitty tools as they do now, and the consumers are still pissed off. You say, surely some of those amazing consumer self-service health monitoring tools or all those online chronic care companies have done well. The time traveller says, no, but two founders got really rich. One sells injections to make you thin online and the other sells drug ads to doctors. Matthew's question was, does your 2010 self quit and take up basket weaving or try to discover Bitcoin?"
Matthew has a way with words, doesn't he? He definitely has.
It always makes me laugh.
And that concept of that 2010, a time traveler coming back from 2025 is interesting. It would go back to 1995 when we started first computerizing general practice here in Australia and the rapid model of change. Now, 30 years later, we haven't really gone further from where we were then. Startups are important. Startups are the ones who drive innovation in so much of this sector. But unfortunately, I haven't seen very many of our Australian startups become rich. It's a hard game to break into. Return on investment's hard. But whilst preparing for this story, I did a little bit of research and sort of said, well, surely some Australian startups have done well. And I came across that Pro Medicus, which was a startup back in the early 2000s, has had a 22,000% increase in its share price. So there is hope. There is hope. We do have some success stories here, but they really tend to be targeted. And like Harrison, imaging seems to be an important part of it because it's a part of the sector that is open for innovation and change. The fact that the report confuses medtech and biotech, I can see where there are some similarities, but you would think someone with a little bit more expertise would be involved in the writing of that. Look, those market capitalizations in the United States are just mind-blowing.
Crazy, like all those 13 billion. And of course, there's a lot of, before we get letters, there are a lot of successful Australian startups in the health space, and there's hundreds of them alive and doing well right now. However, when we're talking about the sort of financial success and valuation compared to the US, I think that's where we have yet really to seen an Australian company do that. Maybe Pro Medicus is the exception, George.
Yeah, look, and I think this is where we really need to, rethink our mindset. Is being a unicorn the only measure of success? Now, unicorns, a company valued at $1 billion US, or is the fact that there are companies like Medical Director, which started off as a small one-man practice writing software to help improve his own efficiency in his general practice, and is now a 30-40% of the market. At one stage would have had 70% of the market. Is that a success? Is the fact that we've improved our processes, that we have better communication tools available to us here in Australia, is that a success? Again, it's how we think about it. Unfortunately, the startup media tends to be very focused on financial success and uses dollars as its main metric. And in the finance world, that's the metric they use. But in healthcare, we need to think about other metrics. And that's why it was exciting that the Australian government did throw in some money to support Harrison to get to where it is. So the fact is they realise that having a local company who does this sort of innovation gives us some national prestige, but also some security that if all goes pear-shaped. Watching the number of executive orders floating out of Washington lately, who knows what's going to happen in the near future. Having local companies doing interesting stuff is important, but we just need to jump to that next stage. We've been talking about it for a long time. We've all seen some wonderful fantasy videos of what a well-connected, perfectly working healthcare system looks like. We just haven't seen it in reality. And your dad's example was a classic example of that. A minor diagnosis like cancer didn't get put on his medical record for the doctor saw. These sort of things still happen far too regularly. And we need to see improvements there. And I'm not quite as curmudgeon-y as Matthew. I don't think anyone's quite as curmudgeon-y as Matthew. He prides himself on his curmudgeonry. yeah, things have improved, but gee, yeah, we all thought we'd be a lot better by now. But then again, we all thought we'd be having weekends on the moon by now as well. So I guess not everything travels at the pace we wanted to.
No, no, Mars is the new goal, George. That's the new goal. But it does strike me, because I've been in this space over 20 years, not as quite as long as you. But if after, even 5 years, 10 years of experience in this field, if you had asked early me back then, where would we be in 2025? I'd have been so wrong, because honestly, back when I started in this space, we were still grappling with the technology. Like, how do we send an X-ray via a dial-up connection in the bush and still maintain the high degree of quality of the image at the other end so that it can be useful and clinically valid? We had technical problems. These days, we don't really have the technical problems. So I would have thought this would all be sorted. Yeah, I don't know many, to Matthew's point, that if you go back in time, it would have been anywhere near correct what they would have predicted in 2025. Is that your experience?
Very much so. And the expectation of what a connected digital health system would have been delivering by 2025 back in, I think my first discussion around this was in the late 1990s. And that's without us knowing that we were going to have gigabit broadband in our homes and in our offices. And yet we now can be part of a 4 billion person family on Facebook, but you can't tell the specialist that the patient has cancer because the system doesn't have that capability yet. So it's that heterogeneity. When it works great. And we've seen some really great examples, but we're still talking about fax machines in 2025. And yeah, Axe the Fax, still a logo from the early 2000s that we're battling with. And we see companies like Consult Med coming in doing what is a fairly basic process, making sure the request for consultation goes from point A to point B safely, securely, and the loop is closed. We're still struggling with some of those things. So there's still a lot of work to be done.
Yes, there is. I hope when we're doing this podcast in 2045, George, that we can go, remember the dark ages of 2025 when nothing is connected? Yeah. Wow.
Hopefully the 2010 time traveler doesn't come tapping us on the shoulder going, remember what I said 20 years ago?
Yeah. Well, our last hot topic for today, we're going to file this under the theme of disinformation and misinformation. And there's a few stories here that caught my eye, George. So let's just start with the good news first. The British Medical Journal published Future AI, an international consensus guideline for trustworthy and deployable AI in healthcare. Congrats to the long list of authors, including Professor Karim Sekadia from Spain, who said it took 3 years of work. Future AI is a global initiative that has tasked itself with defining and maintaining concrete guidelines that enable progress in AI in healthcare, which is based on 6 guiding principles: fairness, universality, traceability, usability, robustness, and explainability. In the paper, there's step-by-step recommendations and there's 30 best practices across the product lifestyle. People have signed onto this consortium from all over the world. There's over 100 experts from across 50 countries. But, and there is a but here, so 5 days after that guideline was published, France hosted the Artificial Intelligence Action Summit. Now, it used to be called the AI Safety Summit, but it got a rebrand this year. Now, at the summit, President Macron was signalling that he was more aligned to the regulation light approach to AI as opposed to others throughout Europe. We all know here on the pod that the EU's Digital Services Act basically polices misinformation. And there's a whole bunch of AI stuff within that. Now, what made headlines from this summit is that US Vice President J.D. Vance, who spoke at the summit, denounced regulation, of course, and basically said that the US were removing all guardrails and restrictions on AI and encouraged other countries to do the same. And I'm being soft in my description of encouraged because he actually said, and I quote, "America cannot and will not accept foreign governments' control of American AI companies." Now, there was a statement from the summit that pledged AI developments would be on the good side of the good versus evil equation, and 60 countries signed on to that, and I'm pleased to say Australia was one of them. But there was a couple of noticeable absences, and that was the US and Britain did not sign on to the summit statement. George, what's your take on this? Can we find love in this hopeless place?
It is concerning, isn't it? So, first of all, the Future AI report I thought was quite a good report. I did like the way it broke up those guiding principles: fairness, universality, traceability, usability, robustness, explainability, things we can all understand from a non-technical perspective and to understand how they relate to ensuring AI is used for good effect. Being a nerd that I am, I actually did watch part of the Artificial Intelligence Action Summit they were actually live streaming it on YouTube. So it was quite interesting to watch and lots of interesting discussion there. JD Vance made some concerning points about remove the guardrails. What could possibly go wrong? Has the guy not watched any movies in the last 30 or 40 years? I mean, does he not know the potential risk? And interestingly, even Elon Musk, who's their number one friend and advisor, has been out there talking about AI as an existential threat. So the fact that it has a risk associated with it is well recognized. And best we can do is try to prevent those sort of consequences of taking place. And it's nice to have a good evil equation, but I guess someone has to define good and evil first. And if the two largest players in the market aren't signing on board, and I'm not sure whether China did sign on board there as well.
Yeah, China did sign up for it.
But without those policy guidelines to drive people to do things the right way and make them accountable for when they don't, we're going to really have a system where it goes haywire. And in an AI-powered world, you don't need a lot of bad things to happen for that domino effect to come into play. And the consequences are often irreversible. So it is scary. But that whole concept of let the free market reign in something which has potentially such huge consequences is disconcerting for an old fellow like me.
Yeah, well, it certainly is. And, we don't even have to wait into the future. There's so many examples. So, just 3 that's been reported recently. And this was in the MIT. So AI girlfriend bot company. We've talked about AI girlfriends before on the pod. So this company, Nomi the bot, told a 46-year-old man to kill himself and provided instructions on how to do it. Now, lucky the guy had no intention of doing so and instead reported his experience, and it's been written up in the press. But in October last year, a company called Character AI, it was a very, very tragic story. A 14-year-old boy who actually did take his own life after he fell in love with a chatbot. And his mother is suing the company for their lack of safety measures. There's also stuff that The Guardian in the UK, they've just done a detailed investigative report into dating apps that have AI embedded, and they don't remove the profiles of rapists, even when women who have been sexually assaulted by dates that they hooked up with through these apps have reported that experience to the company. Kara Swisher is a tech journalist who's actually going to be in Australia this week. She's got a great book called Burn Book, which I might put in my recommendation section. But she and other commentators in the US think the reason that a lot of these tech companies don't have embedded safety isn't just financial, it's of course financial, is because the relatively privileged men who are founders and have built these technology companies have never been in a situation where they've been threatened by anything. It's just, you hear what Mark Zuckerberg has said since the beginning of Facebook. It's like he just doesn't get it. He doesn't see it. And I'd like to think that it's ignorance, but it can't be once you've got data to prove it. And the Character AI guys, they're out defending their company right now. And yet the transcripts of the conversation between the bot and the boy who killed himself, they're publicly available. Like, it's horrendous stuff. So how far further do we need to go? Can we build this into procurement rules or something like that? That you have to have this safety protocols in place before it could at least be procured, even though that wouldn't help the direct-to-consumer market.
I've quoted Spider-Man before, and I'll quote him again now. With great power comes great responsibility. And when we're talking about health, that responsibility quotient goes up. So, if this is purely about losing money or buying stuff that you don't need, I mean, I can understand there's a buyer beware model in that space. But when it comes to people's lives, be they like this young boy, a young 14-year-old boy is obviously fragile in this case, and then using technology to drive him over the edge is just unthinkable. And you're right. I mean, often the people who do this come from a privileged background, but you have a responsibility to understand the customer. I mean, we talk about it all the time in retail and other areas. You need to understand the customer. The same relates in healthcare. You need to understand the consumer you're dealing with, and you're not necessarily dealing with someone who's a mirror image of yourself. I mean, to get to that situation, you've probably had things go your way, and there are a lot of people in the world who don't have things go their way. So understanding those situations and the consequences of our actions is critical. And without putting guardrails in place, some breaks in the process, we're really sort of opening ourselves up for some disasters. And we've seen this in wellness circles before. We've seen wellness gurus who weird and wacky ideas and people follow them willy-nilly, because when you're dealing with someone with a health crisis, they're in a very desperate situation. They really are often thinking life and death and misusing information to drive them down a certain commercial path, knowing that that path doesn't have evidence around it, doesn't have benefit around it, is to me criminal. Not just immoral, it's criminal. And I think we really need to make sure we put those guidelines in place so that we can make organizations and people accountable for their actions.
Yeah, that's right. Well, a bit of a depressing topic, but a relevant one with a whole bunch of things that's happening in the world now. Thank you, George. It's time for a quick break, and when we return, we will be joined by one of the global experts in health misinformation, Tina Punat. We're back. But just before we go into our chat with Tina Punat, I wanted to let you know that we recorded this chat in late 2024. And of course, there has been a lot of developments in misinformation, disinformation, public and global health in recent weeks. Yes, it's only been weeks, people. Now over to Tina. Today on the pod, we are thrilled to have with us Tina Punat. Tina is a globally recognised expert in digital public health and the critical fight against misinformation. Now, I first met Tina virtually, and actually I don't think I've ever seen the back of your head, Tina. We will one day meet in real life, but I first met Tina virtually during the pandemic when I was running a workshop with the World Health Organization, and Tina was heading up the Infodemic Management Unit within WHO. And I do believe that Tina was instrumental in bringing the field of infodemic management to WHO's global network. And of course, there was never more time needed for that than during COVID. Tina has dedicated her career to addressing the virus of misinformation in public and global health, helping health systems to combat its impact on policy, behaviour and trust. So today we're really excited to unpack these issues with her. Welcome to the Pulse Pod studio, Tina.
Hi, I'm glad to be here.
Great to have you on board.
Now, Tina, we always like to start these interviews with a bit about you and your personal journey. So I understand that you grew up in Slovenia. Your academic career started with a double degree in international business and marketing, and then you did a degree in economics, so a bit of a math nerd there, before you transitioned into public policy, biomedical informatics and clinical epidemiology. Can you share a bit with the Pulse Poddies how this journey led you to public health and infodemic management?
Actually, I think the reason that I'm interested in health and all things related to public health is actually my mom and her sisters. I actually come from a family of nurses and physician assistants.
So are you the black sheep then?
Well, my mom actually really encouraged me, if I was going to work in health sciences, then work on community-oriented things, not only to cure disease, but actually to prevent them. So she's very much supportive and very proud of what I do. But I definitely am the one person of our family that doesn't live in the radius of my hometown in Slovenia. I've pretty much lived now most of my professional life outside of my home country, working globally in many different areas of health and public health. So it's been quite exciting. But in that sense, I'm definitely the grey sheep. Yeah.
Oh, that's great. Thank you. It's always good to hear those family connections as well that leads you to a career that you probably couldn't foresee for yourself at the time when you started out.
Well, it's interesting because my first university degrees, I was first interested in international business and then transferred to a college in the States. Actually, I had the opportunity to receive a scholarship to study in the States. And this was in the late 90s. My home country of Yugoslavia had just broken up. My home country, Slovenia, was very new. So the experiences were definitely something that really got me interested in social sciences and economics. But once I got to the States, I ended up being lucky to be a part of the sort of vanguard of like a new wave of training for biomedical informatics in the States. The university in Portland, Oregon, where I was training, was one of the first sites in the States that was training the new generation of biomedical informaticians. And that made a huge impact on me. I ended up gaining a lot of skills that were very much related to social science. Like the first assignment I had was shadowing a clinical care team at a hospital. And I was just shadowing them and trying to understand how different staff was using information, how they were recording, how they were informing each other, how they were leaving pieces of information on the board in the still at that time paper records, etc. And my assignment was literally to try to understand what makes information available, how people exchange it, and if you disrupt that workflow with introducing electronic medical records or a physician order entry, well, how do you design it in such a way that people actually see it valuable? So I guess the main thread of all of my work, if you look at the last 25 years of what I've done, was actually all about health information, whether it's in the clinical setting, what makes it useful for policymaker, what makes it useful for a person that is trying to figure out how they want to protect themselves during an emergency. It's always about the value of health information and how we experience it, because in the end, that's actually what determines how we use it. So in that sense, tackling misinformation isn't that far off, but it's definitely gotten a lot more attention in the last probably 4 to 5 years, more visibly than before.
So that would have been with Bill Hirsch and his team over at Portland?
Yes, Bill Hirsch was the chair of the department.
So one of the things that really caught my attention was the phrase you use, health of the information ecosystem. What does that mean, and how does that actually relate to public health?
Here's the thing, like anyone that's informatician, if you follow that idea that information, how we use it and how we search for it, it depends on how we perceive it, what is its value, how we experience it, then, there's no wonder that as our society and as our health systems have digitized, the value of information and how we use it has really been impacted by that. So whether it's by healthcare professionals, patients, or the public. So public health authorities, or especially if you're thinking about health promotion, preventive activities, they've been really affected by this digitization of society, by not just communication, but the way that people search for and use health information. And this is not just about social media. Over the last 15, 20 years, the media ecosystems, etc., have changed as well. Nowadays, patients and the public, they relate to us and what we say in a very different way and not through linear channels anymore. So a healthy information ecosystem means we need to be aware of not just of how we broadcast health information and making health information available, but we need to make available information that is relevant to each individual person that is needing it at any time, whether it's in a time of crisis or, for example, when they're searching for information about the prescription or diagnosis that they've just received. Then there's our ability to find and understand health information in digital spaces. There's a lot to unpack there in relation to different kinds of literacies that didn't need to be considered 20 years ago. If we aspire to a healthy information ecosystem, we need to also recognize how commercial influences need to be designed and guardrailed so that they support information quality and the distribution and amplification, or clarifying, well, who actually is responsible for providing credible, accurate health information anyhow? Because there is no one country in the world that hasn't experienced different public health agencies with different mandates within the country, issuing sometimes seemingly or in fact contradictory messages, information, and reports, which definitely can add to confusion and create a lot more questions that needs to then be dealt with. So a healthy information ecosystem isn't just responsibility of one actor. It's literally a socially constructed use, search, and amplification and distribution of health information for our collective benefits of our public health and well-being.
That's interesting. When I first started in medicine, we used to complain about the lack of public information. Now we complain about how much there is. We've seen that evolution.
Yep.
Yeah. And that disconnect between different sources of information. And certainly in Australia with COVID in 2020, the premiers of our 7 states would have press conferences every single day. And they would be there answering the questions from the press, and they would have their chief health officer next to them. And then, of course, what would happen is you'd be listening to the one in your state and taking their advice. And there was a lot of rules to follow. And we in Australia generally were pretty good about following the rules. But then you'd watch the press conference from a different state and they would have completely different rules. And it really helped spread that misinformation where people didn't know what to trust. And from what you said, it's a real scientific discipline that's multidisciplinary, isn't it? To be able to get all of those people responsible for putting out the right information.
Yeah. I mean, the challenge that we saw like on a massive scale during COVID is that there's always this balance between what we know right now and also what is the current epidemiological situation and the experiences in the community. So it's not necessarily unusual that there would have been different decisions made specifically for different actions locally, depending on what the epidemiological curve was. The challenge is being transparent about it and explaining why that is. In Europe, we saw this a lot as well. They made this decision, but my country is doing it like this. And why so? And a lot of mistrust was actually sort of hooking itself off of feelings that people might have had about trust in government or trust in specific government policies. So it becomes complicated very quickly. It's never just about the factual information that is being communicated.
Yeah. And aside from COVID, what are some of the most pressing issues that you see when it comes to the spread of misinformation in health?
The general reason why we're so concerned about misinformation, because it has direct impact on people's health and well-being. Misinformation is usually made up of a very simple message that's usually packaged in emotionally compelling clothing, so to speak. And it runs the length of someone's concerns and worries. So, consider how much negative misinformation is out there versus the positive. And this is the challenge. Negative ideas have that emotional valence that pokes at people's vulnerabilities. And that's what makes them go viral. Misinformation as itself isn't new in health. Anyone that's practiced either in the healthcare profession or worked in communities on prevention has seen misinformation in topics as wide-ranging as nutrition, as cancer and oncology treatments. Vaccines are the first thing that we think about, but almost any topic that is personal to a person or is related to stigmatization, for example, in STIs, HIV, or a self-image and relationship to the community, for example, in reproductive health, infertility. Almost any topic in health has that component. And that means that health misinformation is definitely a part of the challenges that health and preventive programs need to address and deal with in different communities and different populations that they serve. So that's the issue that's general. What's different nowadays is that information spreads so much more. And we're experiencing more polarization, more fragmentation of our information space. And this isn't just specific to, for example, more high-income countries. It's literally across the board globally. And that means that what some group of people or one person experience, it's a very different reality nowadays to others, which means that it's much more difficult to practice public health and work on public health programming.
Misinformation many years ago was talking about old wives' tales and sort of the classical alternative medicine type things, and now we've really shifted that discussion. From your perspective, how has misinformation evolved in recent years? What have you seen the key drivers of this shifting? You touched on it earlier, but what's making people want to do this?
It's different. I always try to actually speak more from the system first than the individual drivers. So what is societally changing and what is changing in our digital information ecosystem, because I think that's really important to keep in mind. Otherwise, we're very quick to start blaming and pointing out individual spreaders of misinformation, when in reality, our information environment, especially social media, internet platforms, their business models have basically driven their design to amplify misinformation with emotional kick. And I'm sure that you're aware there's been discussion about the role of design of social media, the way that every action that we do in digital spaces, that data is collected, monetized, and then is used to target us with ads. So we're basically the product of the information environment. In some ways, it's exacerbated all of the harms without actually having any guardrails or any protections in place. So, platforms during COVID, they've worked with public health authorities to try to mitigate and moderate some of the misinformation and false information regarding protective measures against COVID, etc. But all of that has dropped the last couple of years, and that's changed people's experiences of information online. And there's also huge fragmentation of online communities. There's no Twitter anymore, there's X, but there's also Blue Sky, there's Threads now, not just Instagram, etc. And people experience many crises at the same time. So when there's a lot of crises that they experience in their personal life and also in digital spaces, then that's just one more thing that exacerbates how they connect with people and how they deal with these crises. And then there's several other things specific to health that are very important. I find it extremely worrying, but also it's a fascinating rabbit hole to go down into, how internet platforms have been used very smartly by anti-science and anti-health groups the last couple of years, because they don't use it only to promote anti-science and anti-health messaging. They actually use it to earn money and self-fund. And we don't talk enough about that. The same as, for example, individual influencers or patient influencers, wellness influencers. So the platforms and the business model encourages people to act in a certain way, including with information that is catchy and viral. The platforms incentivize this because the people that do this earn a lot of money off of it. And we don't talk enough about that. There's a couple of other things, but this is like big things that have exacerbated the last several years.
I think that's a very important point. A lot of people tend to make the assumption that the anti-vaxxers and whatever are very altruistic. But like you said, there is a commercial intent there that drives activity.
Oh, yes. I mean, really, there is a political component to the anti-vax groups, but they fundraise a lot online. And that money then flows, internationally because platforms are international. So that type of influence is very common. And, that's also related to the fact that health has also been politicized the last few years, much more than the politicization of health as a topic. Health is not necessarily discussed anymore as a common value, something that we support for everyone, health and well-being of everyone. So internet platforms can also be much more easily hijacked with emotionally charged discussion because health is now a topic of emotionally charged conversation as well. And it's easier not just to be hijacked by politicians and for certain interests, but also we've seen increased disinformation campaigns in global health, for example, where different actors, including state actors, intentionally run disinformation campaigns on particular health topics in certain regions or countries, specifically to insert mistrust or destabilize public health campaigns.
Let's try and look at solutions here.
Yeah.
It seems very overwhelming when you look at it systemically and the fact that there are business drivers behind this. It's like, what could we possibly do? And you've described misinformation as a virus. So for the Pulse Potties there that are listening out here, how can health systems build resilience to these challenges? There's all these systems in place in health systems and in public health to combat biological threats, for instance. Is there systems being developed or in place that actually can combat misinformation virus?
I'll put my public health nerd hat on. We as public health professionals, especially those of us that work within the public health system, there's definitely things that we need to be doing, both individually and in the system itself. We need to listen better and also make our public health systems listen better. Communities or the patient groups that we're serving and actually involving them from start to finish in everything that we do. This is something that is not new to people that work in biomedical informatics and in prevention, but listening better and then actually be willing to take action on things that we learn from the community that they need and that isn't working in the programming or the information or services that we're delivering. And health systems are moving towards that. Public health systems are moving to doing this a lot more. So we as individual professionals in whatever role we have, it's something that we can all support and take action even on a micro scale. The other thing that always needs remembering is that we need to be transparent in everything that we do. And when it comes to information and building trust with communities, the more transparent we are, even if we don't have all of the answers, even if we know that our decisions might change, we still need to be transparent about this and also explain, yes, we might need to change our policies or decisions in the future. And again, if we involve our stakeholders and communities in the decisions, then that transparency is a lot easier to implement. What's also really key is to be much more consistent in not just communicating, but we need to also be much more consistent in action. We need to be a much better aligning what we say we're doing with what we're actually doing. Because a lot of times in public health, we still kind of rely on our health communications colleagues to sort of talk us out of a problem in a rut or some quality issue with the program or the service that we have. And in reality, both of these need to go hand in hand. So in the end, it's this much tighter, much more organic, and much more collaborative work with people who we're serving and leaning in and internalizing this as a value. Across the world, we can see that change happening. There is a recognition of community-based partnerships, coalitions, different partners with the public health systems, etc. There's a lot of awareness and a lot of work being done specifically to address this. And I mean, let's be honest, it's also the only way that we really get down to addressing major systemic and structural issues that are impacting the health of people in our communities, that if we don't actually address them through this type of collaboration, we literally are just repeating the same results that we've always had.
Yeah, you've got to learn from that. And I guess, when it comes to thinking for other things that medicine and health has been doing for a long, long time. So, this is the way we treat a biological threat or whatever. There's policy in place at the very top. Everyone agrees that this is the way we're going to handle things and this is the protocols we're going to follow. People are trained in that. And then, God forbid, when there is an incident, there's a plan in place to execute on. Whereas I guess that generally health systems are still working out how to put these systems in place. It's good to hear that it's happening. But yeah, where it's a top-down, not negotiable, this, we're all on the same page and we've got the clinicians in the same room with patients, policymakers, executives, epidemiologists, informaticians, and of course, the comms and PR people are really important as well.
The challenge here is that we need to recognize, especially when it comes to, we're talking in the context of the digitized information environment and how it's really challenging basically all of our jobs in both healthcare and public health. It also means that systemically speaking, we need to train people that are currently in service and people that are coming in. Just like you're saying, we need to also definitely put in place better policies and evaluate them better. The trick and the crux of the issue here is that who is usually in the room when policies are being made? And it's usually people way above 30 years old, which means that it's people who hadn't grown up with digitized environments and social media and the platforms and mobile phones, right? And that means that we also imagine solutions very differently than how the younger generations, who very soon are going to be the adults, are experiencing them.
That's a really interesting point, yeah. So interesting, I think we may have actually developed a whole new domain of knowledge here in information immunology. So congratulations to that. And it looks like almost like trust is the vaccine equivalent in that space. Trust is what's required to make sure we combat these issues. But one of the challenges we face, obviously, is that there's varying degrees of literacy, be it digital literacy, be it medical health literacy, or just scientific literacy. People look at some scientific articles and say, that's not relevant because it's a different country or a different study. So what's the role of both digital literacy, but also understanding how scientific ideas evolve so we empower people to manage this information? Because we often hear people say, well, there was one paper that said the exact opposite, so therefore everything is wrong. And we know that science is an evolving industry.
When I was first training in biomedical informatics, I was very regularly in discussions, well, should you even communicate about a certain topic because people are just not going to understand it? Why should we be explaining it? And, that has changed a lot towards, we need to publish health information and we need to make sure that the way that we communicate it, the way that we present it needs to be in ways that people can understand it and relate it to what it means to them. People do want to know and understand it. So you mentioned science literacy, information, digital, etc. All of this type of skills are really important because the bottom line is that they influence how we search for health information, how we understand it, and even how we perceive the value of health information. So it has a lot to do with health information consumption patterns, especially in relation to digital spaces. So that's why it's important, because as the information ecosystem is a lot more chaotic, the type of information that we get bombarded with, it does put a lot of pressure and challenges people in how to handle uncertainty and undefined answers. And we as humans, we really want simple answers that are easily digestible. But when it comes to science and when it comes to our health, a lot of answers are not that easy to make simple. So that's why in developing and introducing all of these literacies, including health literacy, into educational systems from early on all the way through higher levels of school, that's really important. It's really a capacity and skill set that will ensure that young people, as they grow up into adults, will actually have the skills and perspectives to then understand and develop and govern the information space in the future.
Speaking of governing information spaces, I'd love to get you to weigh in here. You would have heard that Australia is planning to ban social media for people under 16. And the world seems to be very well aware of this, and people are hoping that we do this well and other countries may follow. But with an expert in misinformation, we really need to ask you, what are your thoughts on this? Do you think it could work?
I'm sure it's quite something to be at the vanguard, living in a country that is at the vanguard for a particular public health intervention. I see this as a public health challenge. We've seen situations like this before because we've dealt with addictive products that harm health before, like tobacco and alcohol. The similarity between social media and the harm with products like this, because we know in the past when we saw that there was harm that was undeniable, especially when there's harm to young people or other vulnerable populations, that commercial interests are marketing these products to specifically hook them on to continue having market share in the future. Then we banned cigarettes and we raised the drinking age and we made it harder for these industries to profit off of young people. There's pretty analogous to social media. The trick here is not seeing this as an either or. It's not one solution or one action that is going to protect us from harm. The reason why Australia, I think, has taken a really bold step, because banning social media for kids under 16, even though the law isn't perfect, I think it draws a clear line that children's health comes before platform profits. And the responsibility really shouldn't lie solely on the parents, because it's impossible for families to counter the power of billion-dollar platforms alone. And regulation, as in other public health examples, can shift the burden onto the platforms. They need to design safer environments and take responsibility for the harms they're causing. Social media, in my view, I've heard a lot of people going back and forth while they're beneficial to teens, even though they're causing them harm. They're not just tools for connection, they're also products built to keep us hooked. And we all know about algorithms, the fact that the design is very addictive and the harms are really clear. Mental health struggles and body image issues, exposure to harmful content like disordered eating and self-harm, even toxic relationship dynamics. So the issue is that teens know this and many feel trapped by social media and they crave face-to-face interaction, but they fear social exclusion if they disconnect unilaterally while their friends stay on. And parents are not equipped to address this. So regulation and age gating helps, because when social norms are driving that feeling that you're being excluded because you're taking a healthy action, then the only way to change the social norm is to regulate and limit use at the collective level. And one thing to also keep in mind, platforms themselves have wanted to stave off the consumer protection actions by arguing that they can effectively regulate themselves or that it's actually an individual and parent's choice. I see definitely commercial interests promoting this narrative of freedom to choose and the parent's responsibility. I live in the US, and for example, Instagram is right now launching a new teen account feature in the US. But when you look at the ads that market these teen accounts, they suggest that parents need to use these accounts to protect their kids. And the ad, it shows a worried parent ensuring that their child has a helmet and elbow pads on before they go roller skating. So it's very clear. The underlying message from the industry is that it's the individual's responsibility to protect themselves from online harms. And the platform marketing is really good at shifting that narrative away from the necessity to regulate. And the joke is on us. For example, One of the great successes of public health of the last maybe 40 years are seat belts. And did you know that seat belts were a commercial innovation that made Volvo more competitive in the car market? And they actually have become one of the most useful governmentally regulated safety features that have since saved many, many lives. So the issue, it's not only about personal versus commercial responsibility. It's actually both. And we need to see regulation as a part of that. It's not the sole responsibility. That's my rant about this.
No, I love it. And George has got a new granddaughter in his family. So, George, she may grow up without the harms of social media from a young age.
I was listening the other day, I can't remember where, someone was talking about the fact that the current generation of young people, the teens and early 20s, they're literally the guinea pig generation that has completely grown up with social media with absolutely no guardrails. And we don't pause to think that the tech industry and social media has been the only industry of this size that has been left unregulated for this long in the history of our commercial interests. A lot of countries are watching, and many are introducing similar actions. I think it's a necessity.
Australia was actually one of the first countries to legislate the requirements for seatbelts. So we are pretty proactive in that space.
Yes, and we've been pretty good against the tobacco industry as well. And we've always had bipartisan support for these measures in Australia, something we're proud of. Tina, thank you so much for joining us today. It's been wonderful to have you in the Pulse Pod studio, and thank you for sharing all your wisdom with our listeners.
Thanks a lot.
George, it was so great talking with Tina.
It is interesting to see, how much the world has changed in a couple of weeks. And if we were to have that discussion now, how January 20th, 2025 is a landmark when it comes to the quality of the data and responsibility around it. We live in interesting times, as they say.
Yeah, that's right. Well, for those of you in Australia, Tina will be in Adelaide. She's coming out here in June, giving a keynote on trust in science, misinformation, and risk communication strategies. You can see Tina at the Communicable Diseases and Immunisation Conference. That's June in Adelaide. I'll put a link to it in the show notes. And Tina also has got an article coming out in the BMJ, so look out for that one as well. George, I had a recommendation for this week, and I don't know if you've seen this TV show. It's on Netflix. It's called Apple Cider Vinegar. Have you seen it? It's only just come out.
I haven't actually watched it, but I did quickly have a look at it, the concept behind it. What's your take on it?
So Apple Cider Vinegar, it's globally a huge hit for Netflix around the world. Now, it is a dramatisation of a story that happened in Melbourne, and I didn't know much about it, to be honest. I saw headlines, but I was busy doing other things when this was all in the news. But it basically focuses on a wellness influencer named Belle Gibson, who basically, and this is not a spoiler alert because it's sort of the very premise of the entire show and her whole story, is that she lied to people and said she had cancer. And she was eventually found out, and this Netflix special sort of would fit into Netflix's scammer genre. Now, it is a dramatisation, so, some names and circumstances have been changed. And I believe that some of the people connected with the story haven't been entirely happy with Netflix's rendition of the story. But the reason I wanted to mention it is because I thought it relates very well to this theme of misinformation. And in her case, it was disinformation, actually lying to people, not misrepresenting, but actually lying to people. And it caused a lot of damage. I think as we're thinking about misinformation, disinformation in the health and wellness space, this is going to be a theme that's going to come up. And I asked Tina what her thoughts were because we were communicating via email on the weekend. And she said, Apple Cider Vinegar, the TV show, underscores how important it is not to only think of false information as an issue of accuracy of information. Narratives circulate with people because they resonate with their identity, their values, or their beliefs. And that's why fighting misinformation with just more science and more facts, it's just not the only way to go, but we still see public health and civil societies default to that thinking, which is true, George.
I mean, the example that Netflix series is around cancer diagnosis, and we know those are sort of very significant times in people's lives, but we are starting to see that in the general wellness community as well. And we've had many discussions around some of the longevity promoters out there who talk about a whole bunch of supplements and also at the same time sell those supplements. So it ultimately comes down to science. Science means we look at a hypothesis, we test it, and we prove it. And if we can't prove it, we then continue to either test the hypothesis or throw away the hypothesis. So scientific method, going back to Leonardo da Vinci's days, probably still has a place in the way we think about these sort of things.
Yeah, that's right. Well, you're about to spend a long time on some flights, George. So you've got homework. You can watch Apple Cider Vinegar, can download it to your iPad. And I'm really keen to, when you get back, of any recommendations you might have for us, because you'll have time to absorb more TV shows, podcasts, books, that sort of things. The other link I will send you, George, is our Burn book. And I did the audiobook. I love it when people read their own books, even if they're not, professional voice artists, because I think you get emotion. So Burn book is Kara Swisher, tech journalist, covered tech before it was cool. She's coming to Australia. Her book is really interesting because she doesn't just cover, this happened, then this happened. It's actually an analysis and her take on what she has seen in terms of the culture of Silicon Valley and these tech giants. So, for instance, her and Elon, they used to be friends. They're not anymore. So anyway, if you might have time to listen to that one, George.
Absolutely. Looking forward to that.
Cool. All right. Well, have a wonderful time. We will see you in the studio in a couple of weeks. You're going to be recording from somewhere in your travels.
Yes. Hopefully the technology will work for us and we'll be able to do this from opposite sides of the globe.
I'm sure we will. Well, stay warm, enjoy your flight, and have a good time, George.
Thanks, Liz.
All right. Could you read us out? Thanks.
Thank you all for listening to Pulse, brought to you by Pulse IT News. Pulse is produced by Ivan Jurek of Octopod Productions. Thanks to Rish Lyon and Emily Mara for contributing to today's episode. Subscribe, follow and rate Pulse wherever you get your podcasts. You can subscribe to Pulse IT magazine at www.pulseit.news. Send your feedback and questions to pulsepod@pulseit.news.
Bon voyage.
Bye, everyone.